Africa now have the capacity to make the diagnosis, and some are demonstrating that, unfortunately, through the diagnosis of COVID-19 cases. A lot of syndromic surveillance systems, early warning systems, polio systems in Africa are now being turned towards detecting ARI. The network of 2 reference labs for influenza surveillance and the network of labs for national influenza labs have been working together on detecting, doing systematic testing in samples collected with suspected flu, and they're now testing those samples systematically for COVID-19 across a number of countries in Afro. 41 of 47 countries in the Afro region, the Afro region is essentially sub-Saharan Africa in Africa for WHO, have completed comprehensive national action plans for the control of COVID-19. At the moment, we currently have our staff working today in Washington, completing the mechanisms by which funds will be released into those plans. But in the meantime, as that has been done, we have sent millions of dollars through our WHO system to provide support for training, provision of PPE, further support to the labs, etc., etc. We can provide more of a detailed update from our Africa office on other matters, but there still remain concerns and weaknesses, and the things you mentioned there, like isolation facilities. For example, in Congo today, yesterday we had our first case. We're already redirecting some of our Ebola response capacities towards the potential isolation and treatment of cases. I think in other countries, in Nigeria, for example, within 48 hours of the first case, Nigeria had established a 100-bed isolation unit. So, but I think the development of the clinical support and isolation services is uneven. And while it may be present at national level, one of the things we found during the Ebola outbreak was that reproducing preparedness at sub-national level, at district level, is another challenge that we need to address. So our work now is moving the preparedness activities from the national level down to the district level in all countries in Africa. But I think we are pleased with the development so far. We believe there may be an element of underdiagnosis in some countries, and we're chasing that and trying to activate surveillance on the whole continent.
Mm-hmm. Thank you. And to add to that, countries in Africa have been our focus, and we're very much encouraged by the progress we have made through our regional office in Afro and also the Africa CDC. As you know, our major concern was, the introduction of this virus in countries with weaker health systems, and our focus from the beginning was where our concern is. So there is progress, but at the same time we will continue to build on what we have been doing, and Africa will continue to be our focus, and especially in building capacity and improving the overall preparedness. So Murakoze Chane for your question, Christophe.
Can I add one more thing? Is that in addition to what we're trying to do in terms of providing guidance and supports and kits and building on existing systems that are there, there's a training element that we've been working on. And given the demands on everybody's time and the demands on people's ability or inability to come face to face, we're trying to look at innovative ways in which we can translate some of our training materials through online courses and through interactive sessions so that we can speak clinician to clinician, IPC specialist to IPC specialist, to provide that one-on-one support where that is needed. And so that will continue as this situation evolves.
Thank you very much. Catherine, here in the room, please.
Yes, Catherine Fiancon-Bokonga, France 24. I'd like to have your reaction about what's happening in Italy. They have a shortage of equipment, of supply. They need more health